Apparently you were diagnosed with epilepsy during the shooting of Dangal.
This was very traumatic for me. जो भी मेरे आसपास था मैंने बोला मुझे सीजर आने वाला है, किसी को पता ही नहीं क्या है. Luckily आमिर था, सानिया थी. I bit on her apparently and she was bleeding. फटाफट गूगल किया, उनको आंसर्स मिले. I have no memory. I just remember feeling a lot of fear and passing out and ending up in the hospital. He was like, oh, this is for attention. They told my parents. And maybe कुछ drug use होगा. The doctor said.
Because it's not testosterone, it's not happening to a man. I didn't know epilepsy is so common.
Seizures can come in multiple forms.
Yeah.
The single event is called a seizure, and if it happens again and again, then we call it epilepsy.
I'm not mad. Why are you giving me medications?
This is the other misconception.
Because these are the visuals we have of people having episodes.
छोड़ो ये सब. I went on internet and I was like, let's talk about epilepsy.
How do you know that you have diagnosed epilepsy, or can it be somebody doing drama?
Most people panic. They'll say, oh, वो गिर गया और shake हो रहा था. Just because the tests are normal, it doesn't mean you can't have it.
But there is no empathy, and that's when even you disconnect. इसको तो condition है, इसके साथ काम नहीं करेंगे. I would rarely go for screenings. I would rarely go for a party. क्यों मुझे डर था कि अभी आएगा और सबके सामने आएगा, इंडस्ट्री वालों के सामने आएगा और पैप्स के सामने आएगा तो क्या? It's ugly.
I don't know if you're aware of this Pokemon game. It has a lot of flashing lights, and the incidence of epilepsy in children, like the number of seizures, just went up dramatically.
कि मेरी condition इतनी बुरी नहीं है. There are kids who are 5-6 years old and they get 5 to 10, God knows how many seizures a day.
80% of seizures stop on their own in a minute or two. So it's only the remaining 20% that you need to be worried about.
So I decided to start with the journey of bulimia, and when I go to somebody's house, the first thing I do is open the fridge. Like, it's a toxic relationship with food, which I have learned to manage.
So is it true that there are some of these conditions that women are more susceptible to, like anxiety, stress? There's dementia and stroke as well. So women grow up hearing that we are too emotional, too sensitive, that we overthink everything. But nobody tells us that the female brain is actually wired differently, shaped by hormones, stress, sleep, pregnancy, perimenopause, menopause, immunity, and that these changes are biological, not behavioral. I myself have never had a neurological condition, but as I now enter the perimenopause phase, I've started noticing things in myself. There are symptoms like insomnia, there's brain fog, and actually there's a fact that I wanted to share with you. Neurological disorders are not rare. Many affect women more than men. For example, migraines. One of the most common disabling neurological conditions is 3 to 4 times more frequent in women than in men. And in epilepsy, especially certain subtypes, studies have also found a higher proportion of women among diagnosed cases. And beyond just numbers, when women suffer from disorders like migraines, epilepsy, the attacks can last longer, be more debilitating, impact work, relationships, daily life quite severely. And that's why I felt today's conversation was important to have. Hello and welcome to All About Her, a space where we have honest and hopefully meaningful conversations about women's health, wellness, happiness, and self-care. And today we're discussing brain health. Our first guest is someone whose work has always spoken louder than introductions. She's an actor who has played some of the most powerful, some of the most physically demanding roles in Indian cinema. But behind that strength is a woman who's been navigating something most people don't. She's been living with epilepsy, understanding the triggers, rebuilding her relationship with her mind and body, and doing it all while being in the public eye. So please welcome Fatima Sana Shaikh.
Hello, thank you so much for a lovely introduction.
Arey, thank you very much. Thank you for being here.
No.
And
I'm sorry I've been pushing it, but I am very glad that we are meeting and talking about this because it's very important, and the more it reaches a larger audience, it's just going to create a lot of awareness, and very few people talk about it in a very dignified manner.
Yeah.
And I trust you, and you've been doing such great work, so thank you so much.
thank you so much. Firstly, congratulations on your film.
Thank you.
And all the work. The last time we met, we were working out together.
Yes.
And I had no idea at that point when we were just chatting and I was saying I'm doing a podcast. And then I don't know whether you mentioned it or then I read about it, and I always wanted to have a podcast on brain health.
Yes.
And then suddenly I thought, oh, maybe there was a reason why we met and that
Yes.
happened. But I've gone ahead of myself because I haven't introduced my other guest.
Yes.
Our second guest is someone who sits at the heart of neurological expertise in this country. She's one of India's leading neurologists, a specialist who has, I think, spent decades diagnosing, treating, guiding patients through many complex conditions like epilepsy, but also migraines, strokes, neuroimmune disorders, and overall women's brain health. So we're honored to have with us Dr. Jayanti Mani. Thank you
Hi,
both.
Soha. Thank you so much. And as Fatima said, even I would like to acknowledge this edition of yours on epilepsy, because as we all like to talk about various common conditions, while epilepsy being so common, I don't think anybody wants to speak about it. And this is the reason it's been shrouded in a lot of unnecessary baggage,
Right.
which we have to shed. And I think right information is the way to do it. I'm so glad you're doing it today.
Yeah.
Thanks, Fatima.
Yeah, thanks, Soha. Thank you
Thank
for
you,
coming.
thank you. No, I actually know nothing about epilepsy. I know very little about brain health, and I think most of us, and I hope I'm not wrong, will probably feel like the brain is this very unexplored, very complex thing that is very delicate,
Yeah.
protected by this cranium that we have, but one little misfiring and it all goes, yeah. So, and we don't talk about a lot of things. As you said, epilepsy is very common. I didn't know epilepsy is so common. There's a couple of people in my introduction that I referred to who are sort of famous people, notable people who have epilepsy. It's not a very long list, or perhaps people don't talk about it so much. And I know, Fatima, you have spoken about it. And apparently you were diagnosed with epilepsy during the shooting of Dangal?
Yes.
So that's quite later in life?
Yes, yes.
So how did that come about? How do you know what happened?
I was training, and उससे पहले एक दो बार आया था बचपन में, but
I remember that when I have
Like
gone back to, because we always start, asking questions from when you're born and then take it from there, because seizures, which happens as episodes, can look so different each time that most times people may not even recognize that it was a seizure.
Right.
Yeah.
So first tell me about Dangal and then tell me about what happened when you were young.
I have no memory. I just remember feeling a lot of fear and passing out and ending up in the hospital. And one of the times it had happened was when I was in a dance class. I was dancing and I passed out. I was getting a seizure. One of the girls kept her hand. Then I bit her because उसको लगा, बोलते ना कि चम्मच डालो ये डालो, तो बेचारी ने अपना हाथ डाल दिया पागल जैसे. तो I bit on her apparently and she was bleeding and God knows what happened with her. They took me to the hospital and I woke up like in a hospital. So I was in a dance class, no memory, and I'm here and 10 people are looking at me from the top. And I was like disoriented, I don't see familiar faces, I don't know where I am and why am I here? And I started crying, and so then later on the doctor said, I don't know why he said that. He was like, oh, this is for attention. They told my parents. And maybe kuch drug use hoga.
The doctor?
The doctor said. Maybe he was also unaware. God knows what happened. Why would he, he came up with some judgment.
So this is not a specialist doctor?
Not a neurologist. A basic होता है ना ICU में, ICU नहीं जो casualty में होते हैं. And my parents, of course, they were like, what? Drugs? And I got all the tests done to prove that I am not under any influence. And that was also upsetting because there is nothing. I was 14, 15. And somebody to accuse that was really disturbing. And to accuse that I am doing it for attention when I have no understanding of anything. I am getting attention in other ways.
Right.
So this was very traumatic for me. And then this was one of the very strong memories I had of getting a seizure. And other people told me that you were shivering, you were convulsing, I threw up, clenching, हाथ मोड़ना, वो सब हो रहा था. And then I was training for, but वो time पे क्या होता था ना, मुझे auras आते थे. पर मुझे नहीं मालूम था कि auras क्या होते हैं. So basically, there is this light that is just hovering here on this side, largely it's always on the right side. And it ऐसे होती है and then धीरे धीरे बढ़ती जाती है and it just takes over. So now there is fear कि now this thing is there, कभी ये मेरे को लेके जाएगा and I'm out of it, I have no idea. Sometimes it's there and it goes away. So in Dangal, few times this happened जहाँ पे मुझे आया aura and then it passed. And while we were shooting and I was training, and it came and I was like कि नहीं कुछ नहीं हो जाएगा. And then बढ़ता गया जो भी मेरे आसपास था मैंने बोला मुझे सीजर आने वाला है. किसी को पता ही नहीं क्या है, मुझे भी नहीं पता क्या है. एंड लकीली आमिर था और सानिया थी, कृपा शंकर बिश्नोई जो हमें ट्रेन कर रहे थे वो थे. एंड फटाफट गूगल किया, उनको आंसर्स मिले, उन लोगों ने साइट पे रखा जो भी हुआ. एंड देन इवेंचुअली आई थिंक एज अ प्रोडक्शन हाउस दे टुक इट अपॉन देमसेल्व्स कि वी हैव टू फिगर आउट व्हाट दिस इज बिकॉज अ लॉट वाज राइडिंग ऑन मी, अ लॉट. एंड द होल फिल्म. And they took me to a doctor, they did all the MRIs, did EEG, sab kuch. They took me to a certain doctor, neurologist in Bombay at that time. He put me on a medication. Now, I don't know, like it was a medication that was just too much for me. I was, like aise lagta tha ki I'm under the influence. So I couldn't walk straight, everything was wonky. I was feeling very depressive and angry. Like I was all the time very angry and sad, very, I felt very alienated. And then I stopped taking medication. So I started medication and I was feeling all of this and I was like, I can't function, I have to wrestle. And then I decided कि नहीं मैं नहीं लूँगी, किसी को बिना बताए मैंने छोड़ दिया. Now because छोड़ा, I would get a seizure. But I was so scared that anybody would see me getting a seizure that whenever I would get auras, I would go to the bathroom, I would lock myself, I would put myself on the side, hoping that it comes and it goes and nobody would come to know. But eventually it went on for good 4 years.
My God.
Yeah.
I just want to understand the chronology of the dance class and Dangal. There's a period of time between
There's
these
a period
two
of
things.
time. A good 5 to 6 years.
Yeah.
Easily.
I have to ask you this point, Dr. Mani, for everyone watching, the basics. What is epilepsy? What are auras? What is happening in the brain?
Right. So the brain is, has a lot of wiring. It's an electrical organ, so to speak. So I don't know if you're aware, you can apply electrodes on the brain and you can actually measure the electricity in the form of waves, which is called an EEG. Right. So normally there is brain electricity all the time. It's because the various parts of the brain cells are connected to each other by what are called neurons, and they have like thread-like, extensions which look like wires actually, and they connect different parts, and the electricity is going up and down in a very organized manner. Right. That's what makes us move, makes us think. Even when you're sleeping, there is electricity in your brain. Now, if there is no electricity, you're kind of dead, right?
Kind of dead.
Yeah. So, but when it is going out of range and it's just getting disorganized, maybe even some part of your brain, that part of your brain may misbehave because it behaves a little differently. And so that person may experience something which is out of the ordinary to the point of looking a little bizarre because it's not behaving in a coordinated way. So when you have abnormally discharging neurons which produce electricity which is irregular for a few seconds to a minute, that's all. Usually it kind of stops its own self and resets itself. In that period you behave a little unusually and that's what is seen as a seizure. So because it can happen in any part of your brain, there can be many different things that can be seizures. So there's no one symptom. And again, to say this, just one seizure can be triggered by anything. Just even your sugar going down in your body, your sodium levels going down, high fever in children. So you can have one seizure. That's the brain's, if I can use the word homeostasis, that's the metabolic, no, that's only for temperature. For any physiological phenomenon, there is a normal range, and we call that, when the balance is maintained, it's called homeostasis.
Right.
So if that is not maintained and it gets disturbed,
right,
the brain can react with the seizure.
Right.
So every single seizure doesn't mean you have epilepsy.
Right.
So like the doctor thought, maybe she has had something, like a hallucinogen or something which is excitotoxic to the brain. So that can trigger one seizure. So it was possibly appropriate of the doctor to think, if it was the first time, that could also be one of the reasons, not that it is the reason in her.
Correct.
So, and there are so many other things I mentioned. Only if this keeps happening again and again, without sometimes even a provocation, then that gets labeled as epilepsy. So single event is called a seizure, and if it happens again and again, then we call it epilepsy. Now this aura thing is about something like a warning. So if you're aware and it is starting in a small area, even before you pass out, you may experience a feeling which you recognize is happening before your seizure. Like she sees lights, some people feel their hand is just jerking, or they may hear some sounds, or they may just
always
feel
be
afraid.
some kind of warning sign?
Not necessarily, not necessary. If it spreads very fast, the spark spreads very fast, there's no time. You lose your awareness even before you can experience the aura. So you don't always have to have it.
I will come to you many questions about why and what and
Sure.
But I just wanted to go back to, because Fatima, you were saying that during the shooting then you understood, okay, mujhe seizure hone wala hai. So that when it happened to you when you were younger and the dance classes, etc., at that point, who did you talk to about it, if anybody? Not just in terms of confiding in someone कि मेरे साथ ऐसा ऐसा हो रहा है, but also medically at that point, did you speak to anyone?
Nobody. I thought कि हो गया है, अभी some डॉक्टर को ही समझ में नहीं आया है तो वो मुझे मिसअंडरस्टैंड कर रहा है. मतलब इंस्टेड ऑफ आस्किंग कि अच्छा MRI करो, EEG करो, ये करो, वो करो, एक रैंडम सा स्टेटमेंट दे के छोड़ दिया.
हाँ.
तो एक तो फिर आपको भी लगता है कि यार आई एम नॉट बीइंग अंडरस्टूड एंड आई वाज सो यंग. And it's actually when I got it on the set of Dangal that, and they took me to a doctor, they did MRIs and EEG, and then they took me to a very big doctor, and he gave me medication, and I was just feeling like I'm not mad.
Right.
Why are you giving me medications?
Yeah.
Like just something happened, sure, but I'm not crazy.
But do you know what that medication, what it was?
I know,
what kind
but
of-
I don't know if I can talk about
Okay.
it. It's a seizure medicine. It just, to me, it didn't suit me well. So also I think first time I was taking a very high dose, that के my body was not reacting well, weight also शायद पता नहीं क्या होगा, and उसने भी दे दिया होगा कि एक certain dose because it was at that time very active.
Yeah.
But like I also didn't connect with the doctor so much. He wasn't understand what I was going through. If I would tell him that I'm not feeling good, that I'm feeling sad and I'm feeling angry, I'm not feeling like myself, I snap. If somebody is talking around me, I would feel like hitting them. So that was just not how I would usually behave. So मेरे को था कि मुझे इस डॉक्टर के साथ तो नहीं करना. Then I went to a therapist. And पता नहीं किसी ने बोला हुआ कि रिकॉर्ड करना चाहिए. Luckily during the shoot of Thugs, I got a seizure, and the manager there, she recorded me. So I had a video. And I went to a therapist, and he was like, "Oh, you're an actor, अच्छा अच्छा." क्योंकि perfect therapist मिलना भी बहुत tough है.
No, it's like
very
finding a
tough.
husband.
Yeah, it's so tough. So he first judged me because I'm an actor, and that I'm so young, and that I'm a girl. Oh, अच्छा, you're getting a seizure? No, who said you're getting a seizure? I said the world is saying that I'm getting a seizure, and they said that I have epilepsy. A doctor is saying that I have epilepsy.
There's a proper medical diagnosis.
Yeah, and there are people on set who've seen it, and like मैं कैसे बोलूँगी?
So if I can
I want to ask you, actually, the question is then, how do you know that you have diagnosed epilepsy, or can it be somebody doing drama?
So this is the challenge, right? Because many times an MRI or an EEG can be normal, even in a person with epilepsy or seizure. So it is the detailed description you get of the event that helps.
Yeah.
And most people panic. They don't even observe enough. You ask somebody when they come to the clinic, they'll say, "Oh, वो गिर गया और shake हो रहा था." Now this can happen in so many situations, right? So it is a challenge, and we keep telling people, and it is not easy because at different times you're with different people. But that is the reality that it takes. That's why sometimes it's a journey even coming to a right diagnosis.
Yes.
Yeah.
So the first doctor, you may say, is judging because they have half knowledge and they don't know yet. And expressing ambiguity is not done in Indian medical scenarios. You probably can do it abroad and say, I still don't know what you have.
Yeah.
But if you say that to anyone here, oh, this doctor doesn't know what he's talking about, so let's go to the next doctor.
Yeah.
So then there's a next doctor seeing you. He's seeing you for the first time.
Yeah.
So he's trying to understand. So this doctor hopping also happens.
Yeah.
And there's no continuity in the understanding. And when you have a seizure, you go through so many emotional things, and it's about, you know, rest of your life living with a few
Yes.
restrictions. So even the doctor doesn't want to overdiagnose you. So there's a lot of complex
Correct.
aspects to the problem.
Correct.
It's interesting you say that there are actually things that even medical science doesn't know
Yeah.
about
That's
the brain.
because one event, and if it's poorly described, and as I told you that seizures can come in multiple forms,
Yeah.
and unless there's a pattern that
Yeah.
you can
Which takes
recognize, which takes time. So unless it happens, and we don't want it to happen to you.
Yes.
Yeah.
So there are two ways to handle it. Explain the ambiguity and be willing to live with it for some time and let it happen, unless you have found something very obviously wrong in the scan or in the tests. If nothing is wrong, and then it takes a lifetime to understand, not a lifetime but a few years of training, which one can you leave alone and which you can.
Yeah.
Are there some tests that one can do, like you said, in the scan to confirm a diagnosis of epilepsy? Like you said,
can.
the EEG may...
You can. There is no
You don't know.
100% confirmatory test. The MRI, if it shows you something and if it's correlating with the symptom, it's useful. The EEG, if it shows something and if it's correlating, it's useful. That's why putting 2 and 2 together is important. Just because the tests are normal, it doesn't mean you can't have it.
Right.
And also there is this, as she says, a lot of people when they are mentally stressed have behaviors that look like seizures.
Yeah.
Yes.
That also.
We.
But पता है क्या है? That all of that she was able to say with a lot of empathy.
Yeah.
So why, you know, I connect with her the most and I stayed with her since so many years because the other therapists were not sensitive.
Yeah.
They didn't understand my fears. They didn't understand where I am coming from. तो वो जो हार्ड होता है ना कि हाँ तुम्हें तो कुछ नहीं है, हाँ तुम्हें क्या पता, तुम्हारे तो तुम ये है टंटे वंटे, आई थिंक वो लोग भी डिसेंसिटाइज हो जाते हैं लोगों से, क्या मालूम. But there is no empathy, and that's when even you disconnect because you're anyway
it's
alienated.
True. I mean, I totally understand.
Yeah, you're anyway alienated. Other people don't understand. You think कि you know होता नहीं मैं तो ठीक हूँ, मुझे थोड़ी ना कोई बीमारी है. How can you say that I'm sick?
Yeah. Anyway, you're struggling with coming to terms with the fact that you have to-
Exactly.
Yeah.
That is the journey.
Yeah.
That takes that much
Yes.
time.
That takes a lot of
Different
time.
amount. And
Yeah.
you're right. The right doctor at least may portray it to you in the right perspective.
yeah.
Sometimes.
So how did you find each other?
It was a long journey. I met so many doctors and I didn't accept it ना कि मुझे भी नहीं चाहिए था, मुझे medication नहीं लेनी थी, तो मैं भी on and off जा रही थी, उसकी वजह से मुझे episodes भी आ रहे थे.
What was the thing that made you not want to accept it most? Could you identify that? Was it fear? Was it...
I felt like people think that I'm mad.
So this is the other misconception.
Because these are the visuals we have of people having episodes.
Attributing, correlating epilepsy and this word madness, and that word doesn't even exist anywhere in the medical literature. You can be mentally, deranged in some ways, but this word mad does sound so, unaesthetic, if I can say that.
Right.
And that's the word that comes to her head.
Right.
Yeah.
And if that's the word that's coming to your head, you want to just kind of
Disassociate.
avoid
Yes.
it and kind of in complete denial.
Yeah.
But madness is also just something that we don't understand. Therefore,
It's
we
a
just
word.
give it a label.
Yeah.
And if it's a visual also that is that incites fear in someone because there's a loss of control or you don't know, even if a loved one is watching you, it might be distressing for them to see how to help.
The visual is
And
very
therefore, if we
distressing.
try and understand it, demystify it, destigmatize it, then we can maybe
Work
just deal
towards
with it a little bit better.
Yeah.
We talked about certain, like you said, lights and aura. That makes me think, is there any connection between triggers and lights for you?
It is, but now I think because last time जब हमने stroke test किया था EEG में कुछ दिखा नहीं, तो मुझे लगता है कि कभी-कभी एंजाइटी की वजह से भी ना ये हाँ आने वाला है तो मतलब आप ना डर जाते हो तो आप साइड में हो जाते हो. मुझे हेडेक्स होते हैं लाइट्स की वजह से अब like so bad, like migraines when I'm working long hours and there are harsh lights, and if the pain starts, I'm dead. But you have to work through, you can't complain.
Yeah.
So
And you want to be lit well.
so so there are so many. अब मैं थोड़ी ना डायरेक्टर को जाके बोल सकती हूँ कि आज शूट मत करो मेरे से क्योंकि मेरे को ना सर दुख रहा है, तो अब वो बेचारा भी नहीं समझेगा, कोई और नहीं समझेंगे कि वो सिर्फ सर दुख रहा नहीं है.
हाँ, it's not just a headache.
It's not just a headache, and I'll have a pill and it'll be fine at that moment.
Yeah.
It's I'm dead.
Yeah.
But now you learn to.
So again, interestingly, some types of epilepsies are sensitive to lights and flickering lights more than just a bright light.
Yeah.
And migraines can get triggered by bright lights. And there are some types of epilepsies that look like migraine as well. And you can mistake
So there's some overlap.
epilepsies coming from the back of your head.
Yes.
Which get triggered with lights.
Yes.
Yeah. And even migraines actually start in the brain. It's like a dysfunction that starts from the back of your head, which controls your vision perception.
Right.
Yes.
So it's similar areas, they can look similar.
Yeah.
So how many different kinds of epilepsy are there? Is there? I know we
I
said there's a lot of
don't-
overlap,
you know,
and
we
we're
can
trying to
group them.
categorize.
Yeah, as
but
I
it's
was
tough.
just telling
It's
you.
like
that-
it's like the universe. Your
Yes.
brain is like the universe.
Yeah.
It's unknown.
See
Yeah.
how much she has learnt in
Yeah.
4 years just by being more aware.
Yeah.
You know?
We've learned that we don't know.
Yeah.
A lot.
No, and you learn that it's complex.
It's complex.
And that you just listen to your own self.
And some things defy categorization and labeling.
Yeah.
And it might be a
So
personal.
you can group them, but each individual
has
is unique.
Has an experience
Yes.
that is different. Are there other things that trigger you, like, of course, flickering lights? Now they even have to put, if you're watching something and if there's going to be some strobe
Yeah,
lights there.
thank God.
There's a warning that
Thank
says
God.
that if you have a condition, then,
Yeah.
this is coming up.
I don't know if you're aware of this Pokemon game that in Japan.
I've heard of Kupa, but I don't play it.
It has a lot of flashing lights, and the incidence of epilepsy in children, like the number of seizures, just went up dramatically when the game was introduced.
Wow.
So I'm definitely going to ask you about what things are good for our brain in general and not, and maybe flashing lights in general we should not be exposed to for periods
Not
of time.
everyone, but some people,
Certain people
who
are sensitive.
Sensitive.
That's
Right.
all. Not
Yeah.
everyone.
Right.
Yeah.
Lack of sleep,
Lack of sleep,
low salts.
low salt,
Dehydration.
Dehydration.
low salt,
And
dehydration.
I think these two actually, keeping it simple, flashing lights and not sleeping and overthinking, over stress.
But I'm thinking your job is lights,
All of that.
is lack of sleep,
Yeah.
grueling schedules.
Yeah.
You're promoting a film right now. So how do you marry those two? Brain health
Then
and
I
your
call
career. And say what? Say, help me. How
But
do you
she's
do it?
managing herself pretty well now because she's hardly calling me.
But she just said, before we started this, she said, I've been meaning to call you because this.
Yeah, I've been, you also tend to नहीं डील करना है, नहीं तो छोड़ो यार क्या करना है.
Again, I'll tell her the same thing. There's no point going and meeting the doctor.
Yeah.
That's the conversation that goes in your head. I can totally imagine that.
But luckily, I am so glad that I met her.
Yeah.
क्योंकि मेरी ज़िंदगी आसान हो गई. एक तो मुझे समझ में आ गया कि मुझे क्या है, मैंने एक्सेप्ट कर लिया कि मुझे कुछ है. And it started when she called me for this seminar that was सम्मान का ही कोकिला बेन में ही हो रहा था. I went there and I met so many people who are going through epilepsy and seizures and parents and families of people, individuals with epilepsy. Because then I realized कि मेरी condition इतनी बुरी नहीं है. There are kids who are 5-6 year old and they get 5 to 10, God knows how many seizures a day.
Really?
बच्चे. और जब मैं उनके पेरेंट्स को देख रही हूँ जाके स्पीच देते हुए बताते हुए कि उनको क्या महसूस हो रहा है, उनकी क्या स्ट्रगल रही है, फिर सडनली यू रियलाइज एक तो आई हैव पीपल अराउंड मी, वी हैव अ कम्युनिटी एंड देयर आर अदर पीपल टू, सो आई एम नॉट अलोन एंड आई एम नॉट मैड एंड I can see other people coping with it through medication by being, disciplined. If I can go to the gym every week, say about 4 to 5 times, this is the least that I can do to myself and for myself, for my health.
Yeah. But it still does, I think, somewhere impact your life in some way. Not just work, but also home, and also just the what's the right word for it? The mental burden, I think, because it's the isolation of it, and you might say it is common, but if you don't personally know someone who's going through the same thing, when you personally know a friend of yours, then you share like a heartbreak or something. We've all had those things. Cancer. But I personally don't know anybody who has dealt with epilepsy, so that can be isolating.
Yes.
And then the anxiety of maybe having an episode in public.
Oof, that's so scary. So initially at the start of my career, I used to not step out. I would rarely go for screenings, I would rarely go for a party, and even though I have stepped out, मैं निकल जाती थी क्योंकि मुझे डर था कि अभी आएगा और सबके सामने आएगा, इंडस्ट्री वालों के सामने आएगा और पैप्स के सामने आएगा तो क्या. So then and it's not a lovely sight. It's not like you're falling like that and कुछ अच्छी सी like, it's ugly. Getting a seizure, it's very ugly. It can be traumatic for the person who's seeing it also.
Yeah.
So because of that, I really alienated myself. I didn't put myself in situations where I thought I am exposed and vulnerable. So now that it has changed, it's more controlled. I have met her, I'm taking my medication, I have more understanding now. I'm okay to tell people around me, देखो, I have this, if this happens, this is the number, this you do, and everything will be fine. But that's because I have understood कि मुझे आपको समझाना पड़ेगा, मुझे awareness करनी पड़ेगी, मैं आपको help करूँगी मुझे समझने में.
Absolutely. I think that has been the real change.
Game changer for me.
Do you feel then when you're taking on a project, is there a sense of, I'm not for your own personal well-being, your safety, and a sense of responsibility? Do you feel the need to share with your producers?
100%. Every time I tell them I have epilepsy, if I get one, I'll tell you I'm on medication. Please set पे एक बंदे को allot कर लो और SOS pill दे दो अगर मेरे हाथ में नहीं है. So there is always somebody who has an SOS pill in case if I get. सेट पे बहुत सारे रीजंस होते हैं शूट कैंसिल होने के लिए. एपिलेप्सी इज द लास्ट थिंग एंड माई सीजर इज प्रोबेबली द स्मॉलेस्ट थिंग व्हेन रीजन ऑफ मे बी वी डिलेइंग आवर शूट फॉर 3 hours 4 hours or whatever. So now I don't feel the pressure of it or the guilt of it, because fortunately I have met people who really want to work with me. And they understand that things like these happen. They are more experienced and they are empathetic. So they don't say कि अच्छा इसको तो condition है, इसके साथ काम नहीं करेंगे. जबकि जब मैंने रात रानी एक शो शूट किया था जो Amazon के साथ, क्योंकि platforms are far more rigid about these things, वो लोग छूते भी नहीं हैं किसी को अगर medical condition है. But Sonali Bose थी. Sonali Bose works with Adapt. You know, she has this institute जहाँ पे बहुत सारे जो बच्चे हैं
challenge children,
हाँ, differently abled people, so उनके साथ काम करती है. There is a place where, you know, she educates them. So I was working with somebody who's already done margarita with a straw and other things. So she was fighting for me. And it was just that you need people around you who understand you.
But do you sometimes encounter people who are not so kind?
अरे बहुत लोग ऐसे, they're just
unaware
and I feel bad for them that they don't have the empathy. मुझे कुछ फर्क नहीं पड़ेगा, मेरे आसपास बहुत लोग हैं. मैं अपने आप को समझती हूँ, मेरे पास पूरा एक अच्छा सपोर्ट सिस्टम है, बहुत लोग समझते भी है. अगर आप इतने अनएम्पैथेटिक हो कि आपको लगता है कि वो अटेंशन के लिए है, इसके लिए है, वो इसका तो चलता रहता है, वो आपकी इशू है.
So can I ask you, when were you always like this, or it changed at some point that you said I don't care?
It changed, you know, when जब भी हम लोगों मेरा वो मेजर एक एपिसोड हुआ था ना, when I was traveling
in your shoot.
No, I was traveling in flight, and then I was on medication, and because they put me on and I had to come back to my medication, so there was a overlap, and I was absolutely not myself. I was like in bed, I couldn't understand what I'm doing, I had like no control, and that really made me so disturbed and sad and depressed that I was like, छोड़ो ये सब. I went on internet and I was like, let's talk about epilepsy. That was the moment that I started talking about epilepsy. I said ke now I have it, I know there are a lot of people who have it, let me just at least start the conversation. It was that moment.
Do you remember how you started the conversation? What was your
nothing
first?
I woke up and I was like ke chalo baat karte hain. There was one interview I gave and उसने मुझे बहुत सारे सवाल पूछे, मैंने दिए, और उसने मुझे by the end of the interview बोला thank you for sharing. और मैं बोला अच्छा इतना आसान होता है. उसने बोला कि क्योंकि मेरे आसपास कुछ लोग थे जिनको कुछ हुआ था, बट मुझे इतनी अवेयरनेस नहीं थी. बस मैं गई इंस्टाग्राम में स्टोरीज, आस्क मी, वो होता है ना AMA, आस्क मी एनीथिंग, एंड दैट्स हाउ इट स्टार्टेड. इट वाज दैट
simple. After you attended the support group or before that?
After. Everything was just after. Then I came for that another support thing, na?
As a special guest.
As a special guest, and I met people who were differently able, who had epilepsy, and you know they were dancing, they were on the stage, they were doing performances. It was so lovely.
Yeah, I think that's just the whole idea of creating a community and connecting.
Yeah, I think that helped even more than the doctor, if you ask me, because you just realize you're not alone. I think even if you meet the doctor, that feeling that you're alone doesn't go.
No.
But I think if you
But
see
you
a bigger
told me about
community,
it.
so which is why, you know, earlier as a doctor I used to feel, what is all this social stuff, and you know, I need to be a doctor, I need to. But as I went on seeing more patients, I realized the role inside the clinic, whatever information we give, is a little sterile. Yeah, only when you get out in the world and you have to meet people and you hear stories.
Yes.
And now storytelling is such a nice way of sharing. And
Yes.
in those days, it wasn't kind of made out to be something different, though grandmas always told stories and we learned from those.
Yes.
So that's where we realized that the support group is such a vital element.
I think it really is.
And sharing stories among people with epilepsy is really helpful.
Really helpful.
And now it's gone a big, taken giant leaps. Now those people, the patients do so much interesting stuff that they don't need us anymore.
Yeah.
A couple of things that you'd mentioned, like this pill, I wanted to understand. So, for example, if somebody is having an episode,
Yes.
or if they've been diagnosed with epilepsy, if they're having an episode at that point, what can you do to help them? As somebody who is completely ignorant, for example, what should you not do? What should you do if you
So in
happen
fact,
to
I
observe
was
this?
carrying, we have a visual card that we have in our clinic. So every patient who visits us gets that card and it just visually depicts what you need to do when you have a seizure. We also have created a short video which is shared on a QR code. And it just mentions what are the things you need to do. So how you need to position somebody, how you should not put stuff into their mouth, should not restrain them too hard. And nowadays you get this, earlier it used to be a pill, now you even get a nasal spray, which is the same medication that the doctor would give you intravenously, but it's now available as a nasal spray that you can put it into the nose like an inhaler. So you need to inform your colleagues around you. And you can just take a picture of that first aid card. And in fact, one of my students did this. She went abroad to the UK for studying. And she says, as soon as I went there, in my hostel, I had a bunch of friends. We had a WhatsApp group. I put that picture on the WhatsApp group. And I said, if any one of you see me having a seizure, this is what you need to do.
Right.
I thought that was so smart.
Yeah, absolutely. Because I'm sure the people want to help, but they don't know what to do.
Exactly.
Yes, and it's easy.
And she says, you won't believe it, because I was sleep deprived. Within 2 days, I had a seizure. But they didn't take me to the hospital. They just managed. And then, it's a new place. I just don't want to land in the ER. And they managed her and she was fine.
And what is in the spray?
It is this, it's called, it's a medication which is available as an injection as well, which, as I said, the doctor gives you when you go to the emergency as intravenously. The same medicine is there in the nasal spray.
And what does it do to your brain?
It's called a benzodiazepine, if I can use a word like that, and it just calms the brain. So it's a neurotransmitter. I'm now getting into a lot of medical jargon.
I would also love to know.
Yeah. So it's a neurotransmitter called GABA, which is so it's a GABA drug which increases the level of the inhibitory neurotransmitter, which kind of calms the brain down. So you give it as an injection.
Okay. There's some talk in the little bit of research that I did about seizures being connected to hormones and periods. Now, I don't know if this is true or not. I'll ask you if you've experienced any connection between your periods.
I have actually.
And seizures?
A lot of times I've gotten auras. वो कभी उसमें ग्रैंड mal सीजर में नहीं गया, but I've had auras and I'm like हाँ पीरियड के टाइम पे ऑरा आ जाता है एक आध बार, but उतना ही मैंने एक्सपीरियंस किया. But there is correlation, at least when I have read about people, women who have epilepsy on social media, they've said that there is some correlation, but
So is there some science?
Yeah, so a lot of conditions, even migraines, I think that's even more common that you get it around your periods. And to some extent epilepsy. It's not a given that it would happen around the period, but it's about the hormonal imbalance.
Right.
So unlike men who have one, main male hormone, the females have a cyclical, ranging between high and low of the estrogen and the progesterone, and when they cycle in a certain way, and just around the period, when the progesterone levels suddenly drop, and that is supposed to be protective to the brain for so many various things. So when it drops suddenly, it can trigger off mood issues, like how you can have PMT, and dysphoria, as they call it, not like a depression, but you just feel low. Can trigger migraines, and some of them it can trigger seizures. But beyond this, we haven't really understood it in much more detail that we can kind of start using hormonal pills for it. It would be too much to do. So we don't
understand it because it's not testosterone, it's not happening to a man.
That's the reason.
नहीं तो होती
बहुत research होता है
बहुत होती
and there'll be all kinds of solutions. But I understand the pill and the spray, but what are things that you have done or can do that might help people also? That are not just textbook answers, but real ones that you've experienced that help you with the symptoms.
So basically,
and with prevention, perhaps.
एक side पे रखना होता है, turn करके, ताकि अगर you throw up, you don't choke on it. शार्प चीज़ें हटानी होती है, अगर बहुत टाइट कॉलर है उसको खोलना होता है, कोई चीज़ मुंह में नहीं डालनी है, हाथ को या किसी भी चीज़ को रिस्ट्रेन नहीं करना है, तो अगर सीजर्स हो रहे लेट इट हैपन. सर के नीचे कुछ ऐसे सॉफ्ट कपड़ा या अगर तक की पॉसिबल एनीथिंग जस्ट लाइक टू इट्स अ लिटिल एलिवेटेड, इट्स दैट सिंपल. आई हैव आस्क्ड पीपल अराउंड मी टू रिकॉर्ड इट सो दैट इन केस इफ़ आई गेट वन, एक तो टाइमिंग मिल जाएगी, एक तो किस तरीके का है, सो दैट मेरे जो डॉक्टर है इनको मैं बता सकती हूँ कि ये हुआ है भाई, ये नहीं हुआ है. बट इतनी बार ऐसे लोग पैनिक हो जाते हैं तो, और उनको भी और लगता है कि ऐसे किसी को सीजर आ रहा है रिकॉर्ड करके. हाँ, इट कैन बी अ लिटिल डॉन्टिंग, बट दैट्स द बेसिक.
That's for during the episode.
During
I
the
think she
episode.
also meant, how do you, what are the other things you do?
I'm saying, so one is definitely to know these do's and don'ts when you're having an episode, but also if there's certain things that you've experienced that if you have done this, then...
Sleep.
And also just to go back to how long...
and medication.
I will ask medication, because you take your medication.
Honestly, when patients come to me, half the time, you know, they're already on the medication. Yeah, it's not that they aren't being prescribed anything.
You miss it.
But the importance of having to take it is what I am giving them gyan about every time. And why is it so important and how they need to manage it. Have a pill box, keep an extra strip in your bag, because
Timer
sometimes you decide to just stay in your friend's place and you know, oh, I've forgotten, and then you're running out of it, you didn't order it on time. The chemist says, oh, I don't have it in stock. So all reasons can happen, but you know, unlike a diabetes where it's only the sugar that will spike up and down, and you know, it may not immediately cause a problem. Here it leads to a very disabling event, which is very makes you feel so uncomfortable for so many days. So that is the reason you just don't want it to happen.
The for lack of a word, the hangover after an epilepsy, as you said, like for a few days you might feel a certain way. How after the episode passes, and typically how long does an episode last?
So typically it's a minute or 2 minutes. If anything is beyond 2.5 minutes, you need to get more concerned, and that is what can become a medical emergency. So I should mention that here. So when you have the spray, you try to use the spray. Even if you don't use the spray, if it's beyond 5 minutes and it's not stopping, you have to call the ambulance or get a car or whatever and rush to the hospital. Because if it goes beyond 10, 15 minutes, it can cause damage to the brain. So you don't want that to happen. But 80% of seizures stop on their own in a minute or two. So it's only the remaining 20% that you need to be worried about. But yes, when it starts, you're not sure how it's going to work. Initially, people always feel that they are very tired after a seizure for a day, for 2 days. But then over a period of time, when they start accepting it, I've noticed people coming back. I bounced back right then, you know, it just took me 15, 20 minutes and I was back to my job. So then I wonder, what is this tiredness about? Is it because you know, you're taking your medicines more regularly, or you become more accepting ki it's just an event?
And you become more
and you just realize to get on with things without, you know, worrying about it so much.
Has that happened, do you feel, with you? Like
every time I've gotten a seizure, ek to I wake up fully disoriented. I have no idea what's happening. I have no memory of what has happened. Even if I have, it's like I can hear voices, but I can't move. So you hear voices, everything, are you okay? All of that sunai de raha hai, but kuch ho nahi. I have no control.
But how long does that last?
That I don't like
have
a sense of time. It may feel long, but I would not think
be too long. But
it feels long.
It feels like it's been there forever. And your head hurts, your brain hurts. And when you wake up, I have had nausea, feeling of nausea. I have thrown up also. I have had my headaches, like a lot of headaches.
So that's the kind of seizure she has. Her thing probably comes from the back of her head. Like how it happens in a migraine, you can have a headache and you have vomiting. Every person with a seizure need not have that. So it's again unique to each person. So it's not a given that you always throw up, but yes, you can.
Yeah. Then there are days when I feel absolutely lost and tired to do anything else. But I've gotten a lot of seizures on set also, and I've bounced back after 3 hours. Like 3 hours I take a break, I sleep, I just rest, and then I work.
Yeah,
Can I
this
ask-
kind of work is so intense, as
Yeah.
you said, bright lights and a
Yes.
lot of action.
Yes.
And
Yeah.
May I ask how frequently you get seizures now?
When I miss my medication,
Which is never.
which is a lot of times never, but also there have been times when I was working a lot बीच में, and we tweaked our medication, मतलब दिन को और रात को थोड़ा बढ़ा दिया था dosage, because I knew I was going to get less sleep. I was shooting nights, I was traveling. So I told her that this is my sked. Now if there is any need for you to tweak the medication, add anything, जैसे अभी लद्दाख में जब भी मैं जा रही थी, so वहाँ पे भी एक मेडिसिन होता है ताकि ऑक्सीजन नहीं हो जाए, बट मुझे प्रॉपरली करना पड़ेगा. So I asked her, she told me 10 days पहले ये शुरू करना होगा, बाद में ये. So there is a proper plan. I can't just continue with the way that I live and I work imagining कि सब सही होगा.
And is this medication you have to take constantly? Like
Every day.
after you have a heart attack, you take heart medication
Every
day.
day.
So you
Morning,
take it
night.
Morning, night, every day. And are there side effects?
मुझे तो नहीं feel हो रहा.
That's
you need to choose, because each
right
person
medication
reacts
for you.
differently. So identifying what suits you
Yeah.
also may be taking a little time.
And what are possible side effects that may show to you that this is not the right medication? Is it like what Fatima was saying, that she feels...
Each medication is different, so they have a different set of side effects, possible side effects. So when I start a medication for somebody, I tell them, in this medication, you need to be aware of this, this, this.
Right.
So for a certain medication, it could be allergic rash. For something else, it could be just mood swings. And it doesn't happen to everyone, but if it does, you need to remember, maybe it's the medicine.
Right.
And we can't be 100% sure with things like mood.
Yeah.
So we
Yeah.
always say, maybe you
They're
want to
dependent
try
on
it.
so many other things.
So you try it for a little longer, and if it's not helping you, we can change.
Right.
Yeah. So mine, because the moment I came
Never
to
tell
her,
us.
इन्होंने मुझे एक मेडिकेशन में डाला जिससे मेरी ज़िंदगी बदल गई. तो क्योंकि मुझे साइड इफ़ेक्ट्स ऐसे कोई फील नहीं हुए, आई ऑल्सो अंडरस्टूड कि आई कैन लिव विद इट नॉर्मली, मतलब एकदम नॉर्मली, मुझे कुछ करने की ज़रूरत नहीं है, मुझे खाली मेडिकेशन टाइम पे लेना है, एंड आई एम एब्सोल्युटली फाइन. सो फॉर मी, meeting her was the best thing
But
that happened to me.
then just a question, if it is such a big difference with taking and not taking it, how do you end up forgetting it? Why does that happen? That is something people would want to know, because what is it that...
Is it complacency that everything is
or
okay
like
now?
denial chalta hai, let it be.
चलना है, एक दिन मिस होगा क्या हो जाएगा, you're bored to just have a medicine. अब मिस हो गया ना, चल कोई नहीं, सुबह 2 खा लूंगी. Like you take it lightly, not realizing that even one dosage missed can actually trigger.
So that's a really important message, I think, for people.
Every day time पे. अब जैसे एक्चुअली जो आप बोल रहे थे ना कि अगर मिस हो जाएगा तो अगर आप कैरी नहीं कर रहे हो तो फिर क्या होगा. मैं अभी दिल्ली गई थी एक शादी के लिए, और थोड़ा आउटसाइड पे शादी हो रही थी. आई फॉरगॉट माई मेडिकेशन and I didn't have the prescription. Through the wedding, I was just panicking because शाम का था, I had to fly the next day. I had come the same morning because I'm promoting. I panicked. I got anxiety. Luckily, my brother was next to me, so he figured it out. We got it. We got एक फोटो था मेरे पास प्रिस्क्रिप्शन का वो लड़का जो था जो गया रनर, he went all the way to the center to get the medication. I was like, thank God. But that's a reminder. कि never not carry your medication. थोड़ा एक्स्ट्रा कर लो चलेगा, एक लिफाफा एक्स्ट्रा कर लो, पर छोड़ो मत.
Yeah, that's true. There's some I've been told again in my research that women's brains are different to men's. And I wanted to first ask you, as a neurologist, is that accurate? And why is it that there's I had made a list of about 10, what do we call them? Conditions that women are more susceptible to, like migraines, some neuroimmune disorders or deficiencies, then of course epilepsy, there's anxiety, there's depression. So is it true that there are some of these conditions that women are more susceptible to, like anxiety, stress, there's dementia and stroke as well?
Yeah, so when you look at the brain and you look at the structure of the brain, if it's a male brain and a female brain, I don't think there's anything different. Of course, the size is going to be slightly bigger because it's about, bigger structure and all of that. But the way it is wired, I don't think the physical things are any different. I think what makes all the difference, as we discussed, is about the hormones, and the hormones affect the patterns in which the neurotransmitters, that's the chemicals in the brain, which are the chemical messengers that help balance the various messaging that happens. So that is what is different, and I think biologically, I think this is the difference. And I think socio-culturally also, I think over a period of time, you know, women are nurturers, and, you know, if we go back to Stone Age, then the males are the hunter-gatherers. So, you know, then the whole psychology and the whole wiring over these generations has been different. So I think that also hardwires us in some ways.
Yeah.
Right.
I think these are the reasons. And there's also one pattern in which men handle stressful situations and how women handle it. Women tend to ruminate more about it. They tend to think more and more about it, whereas men either block it off or, they kind of have an action mode about it, or they block it off, whereas women tend to, you know, think about it more and more. And I think also multitasking on a day-to-day basis is much more at the same time trying to do different things. Because, you know, when you're a mom, for example, you know, you can't say that let my kid wait, you know, even if you're working, if there's something going wrong, you have to interrupt that and get to something different. Whereas guys tend to, you know, put things in little boxes, and they are able to block off something very well.
Right.
I think inherently we can't do that because of the various demands.
Right.
So all that makes our brain as women different from how men function.
That's it. In the notes I'd written like hormones, estrogen, progesterone.
But it's the society.
But society, conditioning, the caregiving roles that we have, the stress that we do not process in the same ways as men do. I think it's fascinating being a woman, but I do think that it's a far more layered and different, and I want to say different, but I do think it's also just a far more complex existence.
And I think with the urbanization and how women trying to work and manage homes, I think we just also invited more multitasking.
But we should.
That's fine.
We want to.
No, I don't say it's a bad thing.
Yeah.
So I'm just saying that the balancing has to be that much more fine and more all the time, you know, that little balancing needed is much more than when it was more structured.
So how do we know when it is stress or when it is spilling over into something that needs a doctor? Even stress, like we need therapists sometimes to help us manage it. But when is it becoming a neurological condition like anxiety or depression?
Yeah, I don't think there's a neat cutoff. It's really it's a continuum. That's the problem.
Like,
but I would say that if, you know, the anxiety is triggered by an external situation and it's proportionate, and if that's why people around you also sometimes are helpful to let you judge whether it's proportional or not, because sometimes you will lose the objectivity.
Yes.
So if you feel that there is disproportionate levels of, you know, reaction, or it lasts much longer than after that trigger is gone, or there's extreme levels of mood swings, you know, and crying spells, or not feeling like you want to do anything, you're losing your appetite, you're losing weight, these kinds of situations, I think it's always better to discuss it with a professional. And when I say a professional, you know, even I noticed that mental health professionals are kind of different. So you need to find the right kind.
Yeah, very important.
Sometimes starting with a psychologist is not a bad idea. But if after a couple of sessions it's not working for you, also think whether it's the psychologist or it's you. It could be both. So maybe they are trying, but you're just not even able to. So when there's a chemical imbalance, just trying to tell yourself that, you know, you will be fine is not going to work. You need that little medication to reset the balance and then give you a kickstart. So
actually, this is connected to my friend Ranjana, who always has a question every time we have a podcast. And her question was related to a psychologist and a psychiatrist, and when someone knows when to move, perhaps from a psychologist to a psychiatrist, and when to actively take medication, perhaps, for something like stress, anxiety, or depression.
Yeah, I wish you know, that these are all, I would say a psychologist is also a person. They also come with a lot of training that can be highly variable. So I would say sometimes when it's unclear, I often recommend to my own patients that you first see a psychiatrist, let them judge for you, ask the questions. Ask, do you really need the medicine? You know, ask your questions, let them answer it. If you're not satisfied, see one more person rather than just be given medications. And don't take it like just because you've been given it, you know. So try to understand why, because knowing why you're taking it helps you take it with the right frame of mind. And often they may not be able to answer how long you need it and all those kind of questions, because they need to see how you're responding. But after you take the medicine, if they call you for a follow-up, please go back.
Yes.
Because what happens, you feel, oh, now I'm fine, why do I need to go?
Yeah.
Right.
But it's a journey, and the mood is often, once you've been prone to a little low mood, whether you're completely out of it is something you want to discuss before you get off your medication.
Right.
So at least 2 visits should happen, and you should check with them, do you really want me to come back? So that kind of a rapport should
communication
be,
should be
yes, should be established.
मेरी medication में mood stabilizer भी है ना,
Yeah,
so
yeah.
that
There
really helps.
Some of the seizure medicines, finally, they are all working on the brain. Many of them work for both
for
things.
both. Yeah, but like for me, the journey has been like when I met her, she also suggested that I meet a psychiatrist, and my therapist also, Jabi Susan. I met her, Susan Walker, and she also suggested that I meet one, and then they did tests, and then with her and with my therapist and Parveen, मुझे BPD है, तो borderline personality disorder. So हम लोगों ने decide किया कि medication लेनी है कि नहीं लेनी है. मुझे नहीं लेनी थी, तो मैं therapy के through and just controlling my medication, I wanted to manage, because I was like मेरे को इतनी medication लेनी नहीं है जितना मैं कोशिश, because sometimes it's cyclic also. So I have learned to manage.
Cyclic means connected again to the hormonal.
Borderline personality is not cyclic. You mean bipolar or borderline?
Borderline. No, but like dips of depression. So those, like I have huge dips.
So that would be bipolar if you're going up and down.
Up and down, yeah. So I'm.
No, again, there are so many. We have this mental image.
Yeah.
That bipolar means you're either crazy or
Yeah.
there are mild, very very mild ups and downs, and
Yeah.
those are very well managed with something
Sometime,
like this.
yeah.
So again, everything is not completely black and white. There is a
is a
whole
spectrum.
range of
ये
things.
वो नहीं है जो हम लोग फिल्मों में देखते हैं.
Yeah,
we're so
that's the
influenced by
problem.
what we see in films.
It can be like 0.001% of what we see in
Yes.
films. So like my highs are extreme highs and my lows are extreme lows, where I don't want to get out of the house, when I don't want to get out of the bed. And then thank God I work, and thank God I have responsibilities.
Because it forces you.
It forced. मैं काम नहीं करूँगी तो मेरा rent कौन भरेगा?
Correct.
So I think that because there are responsibilities that I have to push myself, because I have no other option. Like if I'm working, if I don't come to the set, then I won't get other films.
Yeah.
So there is a lot at stake. So I feel that when you're working and you have responsibilities, you're forced to show up, and that also helps.
Yeah.
Because personality disorders are just some things you need to be aware of.
Yeah.
Typically, you don't use medications to change a personality, even if it is mildly. But it may cause secondary mood issues or anxiety issues for which you will use medication.
Yes. Right.
And the medication that she's on also helps mood fluctuations.
said
So
it's
it's
mood
working for
stabilizer.
both.
For me, yes.
And it's not though that uncommon, but most people don't even realize these mood swings and they don't give it a name.
Now, how many people are exploring themselves or their minds or their moods? Most
Exactly.
people are
And
living-
everybody doesn't get a name to it. And
Yes.
I think she's perfectly normal, but having mood swings.
Yes.
Yeah.
And someone decides to give it a label. Sometimes someone doesn't even reach out to a doctor and they don't get the label.
Yeah. Yeah.
But it's nice to have some awareness, because some things require a little bit of assistance and help and support.
Yes.
And I think we all.
And I think it helps people calibrate their own selves.
Yes.
I'm getting into this phase.
Yeah.
So I need to work on this. What do I need to do?
Yeah.
Am I wrong to think that you've spoken a little bit about bulimia also?
Yes, I did.
Yes. Was that connected at all with any of these?
No. That was just, I think I was going through a phase where, because in Dangal I was eating so much, 2,500 calories or sometimes even 3,000, because I wanted to eat a lot, but I was training, so I was losing a lot of weight. And the moment the film stopped, I'm not training, so I'm not burning, but I'm still taking those calories. So there is, you're putting on weight. So how do you manage? And then I was also on a very strict diet. So that's also like it plays a lot. तो मेरे को लग रहा है कि मैं अच्छा इतनी calories consume करनी है, अगर मैंने कर ली ज़्यादा तो मैं अब क्या करूँ? So you think, and when you start researching, they're like how, there's a lot of nonsense on internet also, and you may get swayed. So I decided to, then start with the journey of bulimia, and I think for good 6-7 months, not longer than that, Sanya identified it, and she said that I know what you're doing. And because there is so much of shame attached, I was like, no. She's like, I know. So then that's what there was this self-realization that oh, something's happening that is not right, because she's pointing it out. And then I used to avoid stepping out. I used to not go for dinners. I used to not go anywhere because there was no control. Like even now, like Bhavik tells me that, breathe. थोड़ा आराम से खाओ, fast मत खाओ, because I can just...
Bhavik is your manager.
Yeah, he's my manager. He's my manager. He's a friend now.
And a friend.
So, yeah. So, I have a habit of just eating. When I'm nervous, I eat. When I don't know what to do, when I'm bored, I eat.
Yeah.
When I go to
a lot of people do. People don't just eat for just the calories.
It's the, in your brain, you're just, it's just some dopamine hit.
Yeah.
And when I go to somebody's house, the first thing I do is open the fridge. It's just a habit. Like, I check what's there in the food, and if I'm getting bored, I just eat.
Yeah.
So, like, it's a toxic relationship with food, which I have learned to manage.
Yeah.
Where I try and start with the portion control, कि जितना plate पे लिया है उतना ही खाओ. But I have learned how to manage it, and I don't want that in my life. It's unnecessary. It's useless.
Yeah.
You don't feel good about yourself. It's the same with smoking. I don't want to do it. It's the worst feeling.
Yeah.
Everybody's tried once when they were young. I don't enjoy it. So, जब पता है कि नहीं मजा आ रहा तो क्यों घुसना है इसमें?
Yeah. But it's again useful to do because anorexia, bulimia, these are things that a lot of
and खाली लड़कियों को नहीं होता है.
खाली लड़कियों को नहीं होता है. And again, a lot of people think, but there are a lot of young people who are going through this. Some of them I know personally also, and it is a very complicated relationship that people have with food and with their bodies and what they see in the mirror.
Yeah.
And it's I think always very inspiring when somebody who is somebody they respect, they look up to, they see working in films, talks about these issues because they feel an immediate connect.
Yeah.
And then if you break that connection with food and you say, if I can do it, then they also take a lot of positive inspiration.
So, and I'm also going to say that to label it as bulimia, I think you need to be doing it to a pathological level.
Right.
Small little bits, phases that people do it may not necessarily mean that you have a condition. Yeah, it may not be a disorder.
Yeah, right. Like for me, it went on for 6 months every day.
So that sounds
may be,
like
they have specific definitions, and I'm not a psychiatrist, so I don't know the labels.
Yeah.
But bulimia is typically when you eat and you keep binge eating and then you throw up.
Yeah. You induce...
and you induce that. Because there's so many wonderful and challenging things about being a woman. I just want to touch a little bit about the hormones, the progesterone and the estrogen. You said you felt certain changes in your hormonal cycle.
Yeah.
And I just wanted to ask you because you said women are different because of the progesterone and the estrogen and how those go up and down in the cycle. So what will be happening to the brain as we, for example, the difference between PMS and PMDD?
That even I would want to.
Yeah, so how, like what, how is it affecting us?
I don't think we have adequate, detailed understanding of what is happening where, because it may be happening at a research level, but not enough for us to use it to change the way we treat medically. But having said that, in simple words, it's about how the hormones affect the chemicals in the brain, as I said, the neurotransmitters and the balance.
Yes.
So it's about the balance, the same balance that when it goes off in certain areas, certain transmitters go down, you have mood, like the dopamine goes down, you become depressed, if it's high, then you get manic. So, but this is too simplistic, and the brain is too, wired in a very complicated way, in a very intricate way. So I think the balances and how exactly where is what's going off and on is still being understood, because we don't have enough techniques to image the brain and all the neurotransmitters in that intricacy. So they can only measure some levels in the blood, but it doesn't tell you how the pattern is changing in the brain.
But
so we're still...
Brain fog real? Like what happens during perimenopause, sometimes during PMS?
These are all kind of words, right? If you're feeling low, you feel a little woozy and you feel a little faded, and then you call it brain fog. So yeah, you feel tired.
But some people really feel like they don't know where they are and who they are and what's happening.
Really?
Typically during perimenopause.
Yeah, but not to that extreme. I've not heard of. Then you really need to think of, are we missing anything like a mood issue and things like that.
Right.
So just because of perimenopause, I haven't seen people coming like completely dazed.
Right.
Yeah.
Just briefly, if we touch on some specific life phases that women find themselves in, like pregnancy, postpartum, there's a lot of postpartum depression, perimenopause, menopause. Again, I feel like the answer will be the same.
It's the
we
same.
Don't really
it's the
know.
same. Finally, it is about, as I said, the progesterone level is dropping right after delivery, and that can cause postpartum depression. And it can be just a passing phase and it may go away. But if you've been prone to depression earlier, you've had phases earlier in your life that you've had mood disorders and all, and if that thing is lasting longer, then you need to address it with medication. Yes.
Addressing the issues, we said addressing them, some solutions. I thought perhaps if you could create for us like just a brain wellness kit. There's certain things like Fatima was also saying that, if I don't take my medication, then I know that I might have an episode. There's certain things like I need to sleep well, I need to sleep on time. So are there certain things that as women we should be doing, perhaps in our 20s, our 30s, our 40s, that will help protect our brain or improve our brain function in some way?
Yeah, I think it doesn't. I mean, in general, it's about 3 realms. This is how I put it. It's the physical realm, which I mean your physical needs, and that would be the sleep, you're eating on time, you're eating healthy. That would definitely be, and exercise.
Are there some great foods for the brain? Omega-3.
We need to talk to a nutritionist about those, but yes, I mean, you can use, and I think a balanced diet as you would have it is good enough. Everyone doesn't need supplements. I haven't had any supplements all my life, but we just need to eat healthy and eat local. We have some of our dietitians who suggest that. So have a balanced diet, and I think that's important. Eat on time. Make sure your breakfast is done well, because that gives you the power for the rest of the day. And small meals in between, don't go hungry, and hydrate yourself well. That's very, very important. Even water, just not having enough water. Sitting in air-conditioned rooms and not drinking enough water can make you really, really tired.
Yes.
Yeah. So that's important. And I think the exercise is such a good
feel good.
The right neurotransmitters in your brain are released, and over a period of time, they've even shown that regular exercise, increases the size of a certain part of your brain called the hippocampus and the amygdala. When they've done a study over a period of time, which has looking smaller, starts
and then with the bigger hippocampus, what happens?
Memory is better. You do better. So they have actually shown that in some studies. Wow. So physical exercise on a daily basis, at least some of it. So that's the physical bit. And then I would think when it's social, you need to have friends and connect and all of that. And in that realm, I would say meeting people and doing more of the in-person rather than too much of the social media. I think that helps a lot. Because overdoing the social media is too much of information overload. It doesn't let you focus. It doesn't let you think. It doesn't let you imagine. You lose your imagination, I think. You don't even listen to your own body in the process.
True.
So because you fill it, you block it with doing other things. So you need to spend time with yourself, just empty, So I think that's the emotional and that bit, a social emotional bit of it.
Absolutely.
So I think if you do this much and then challenge your brain with something slightly different from what you do all the time. Like we were just discussing how you're doing new topics and you're kind of researching a bit. I think that's wonderful to do. Sometimes trying to learn a new language. Or
I'm learning piano now with my daughter.
I'm also.
Well done.
But through YouTube, I need a teacher.
No, I'll recommend.
Yeah, because YouTube is such a tool, so as long as you want to learn.
Especially they say sometimes to ward off things like Alzheimer's, dementia.
It's the same thing, but
meeting
consistency.
Consistency.
Consistency is the key.
Yeah.
Because we all tend to say, hey, today I'll do this and today. So you don't have to do everything every day.
No.
Yeah.
But just keep monitoring your own self. Are you doing something in all of this? Over a period of time.
Like I use my left hand to brush.
How nice.
And I think sometimes having a purpose, having challenges that keep you excited.
Yes.
And each person gets turned on by something different.
Yes,
so
absolutely.
Having that is so
I feel like the excitement in your line of work and the challenges.
I'm so happy that I'm an actor. I'm so lucky that I am an actor, and touch wood, I'm getting great roles where I get to challenge and research and do so much that I feel just through my work, there is so much of happiness and excitement. क्या सीखने को मिलेगा. I'm physically challenging myself. I'm challenging because my brain, because I'm learning new dialects, I'm learning my lines. So there's so much of challenging happening in my life that I'm so full. My brain is being is active.
And then you're using
And
your
as
left hand, you said.
spend some time feeling grateful about that.
Yeah.
I think we don't make that time.
Make that time.
That little time to feel, I'm doing well.
Some of the points are also made with things like just journaling or even talking.
Yeah.
Yes, absolutely.
Expressing what you're
Yeah.
feeling in some way.
Yeah.
Do you
Expression, absolutely. It could be through music as you're learning
music,
to
yeah.
do something,
Yeah.
or
Like-
poetry, or even
Yeah.
just journaling.
Learning.
I think, sorry, I'm
That's
getting
fine.
very excited about this whole
Yeah.
thing.
Tell me about your left hand.
So, I read somewhere that it's nice to sometimes use your left hand. So, I try to brush sometimes, open a dabba with a left hand. जो भी चीज़ें right hand से करती हूँ, फ्रिज को खोलना, कभी like now I started making lines
Nice.
left hand से just to challenge.
Yeah.
And piano is a great way to
Piano,
use your
yeah,
left
left hand,
And
great
it's a
way.
complete, just a different language.
दिमाग खुल गया मेरा.
Yeah, really.
सच्ची मैं
It's tough, right, in the beginning to
It's
learn.
tough. पहले मेरा keys like इतना ही होता था. Now I can touch like C to C.
Yeah,
So
avoid
I can
it.
reach. Yeah, so that's so much fun. Also, I'm not on my phone.
Yeah.
I'm not on my phone. I get so excited to learn and I get so excited to just do new things कि मैं घंटों बैठ जाती हूँ.
Yeah.
क्योंकि I want my friends to see, देखो मैंने ये सीखा,
Yeah,
देखो मैंने, I want validation, then they tell me, अच्छा YouTube से सीखा, हाँ YouTube से सीखा. So it's
No, but
just a nice feeling.
it's nice to have friends. It's nice to
Exactly.
learn something, share it with them. It's motivating for everyone, no?
Because
they're also
the
watching-
validation is not coming through likes and comments.
Yes, it's
and
coming from real people who are benefiting from you playing the piano for them.
हाँ.
It's wonderful. No,
Yes.
I really have.
I think we discover exactly what we need to do when we
Yeah.
just kind of
Yeah.
start talking about it. I
Yes.
don't
Yes.
think it's some rocket science.
And
Only
this
thing
is,
we don't
you know,
manage to do it. To
No,
the
when we
extent.
talk about aging, we talk about diseases, and I think a lot of warding some of that off, not all of it, of course, is
Yes.
just constantly opening up parts of your brain, challenging yourself, trying new things.
Absolutely.
That's how you stay young as well.
Yeah.
And live forever.
Yes.
Okay, one parting comment, which is
Ji.
one thing that every woman should start doing, like if you could just, as a doctor, since we have you here, let's exploit you and say, if you could tell our audience one thing that they could do to protect their brain's health long term.
Yeah, I wish there was one thing. There is no one thing.
A top thing, a priority, something
There's
something
no
you
top
okay,
thing.
something that
Sorry.
you find
Sleep.
people are
Maybe
really
sleep.
not doing.
Sleep.
Yeah.
I would say sleep.
I agree.
And exercise. We don't move enough.
Yeah.
I think we are getting more and more lethargic. We use the elevator. We just get into a cab or an auto rickshaw. We just don't walk or
Sedentary
climb
lifestyles.
or even do all of that. I think our previous generations did much more of it.
पर ये सिटी प्रॉब्लम है. Whenever I go to the mountains, वहाँ पे मैं हिलती हूँ क्योंकि वहाँ पे गाड़ी बुलाने के लिए समय लगेगा. वहाँ पे क्या होता है कि जब ये शॉप में जाना है, अब कहाँ टैक्सी को बुलाऊंगी, किसको मिलूंगी, चल के चले जाओगे. वॉकिंग इज सो नॉर्मल. अगर आपको ब्रेकफास्ट बाहर करने का मन है तो आपको कैफे जाने की ज़रूरत नहीं है. यू बेसिकली यू स्टॉप स्पेंडिंग मनी फॉर बेसिक थिंग्स. यहाँ पे अगर आपको एक जगह से दूसरी जगह जाना है, आप ऑटो लोगे. अगर आपको बाहर खाने की इच्छा है, आप कैफे में जाओगे. अगर आपको कुछ देखना है, आप मॉल के अंदर जाओगे. सो एवरीथिंग इज इंडोर एंड एवरीथिंग इज जस्ट लाइक टू कंफर्टेबल. वहाँ पे अगर बाहर खाने का मन है, पहाड़ में जाके अपना घर का खाना लेके बैठ जाओ. व्हाट अ व्यू. What else do you need? यहाँ पे हम स्क्रीन के सामने बैठ के खाना खाते हैं.
Correct. And that also but thank you firstly, thank you all both for coming here, for sharing this. I think we've had many conversations on this podcast, but for me this was a conversation I really wanted to have about brain health because it's really something I don't know much about, and from our conversation I feel like there's a lot that people will also understand. There'll be some destigmatization to things, there'll be hopefully some acceptance, some education, some awareness, and then we'll just be better off
And
for
once
it.
we chat, we discover ourselves what
Yes.
we want to do. It doesn't really need great insights,
Yes.
but we just need to manage to do it on a regular basis.
So thank you so much, Dr.
Thank
Mani,
you
for
so
all the
much.
wonderful work that
Thank
you do.
you.
Thank you for the wonderful work that you
Thank
do
you.
in very different
And you
Thank
do
you for
amazing.
all the wonderful work that you are
You
doing.
do, absolutely.
हाँ, ये सारे conversations करना और consistently करना, you're touching so many different topics and with a lot of empathy and a lot of research. ऐसा नहीं आप उठ के बोल रहे हो कि अच्छा बताओ अपने बारे में ये क्या है. So there is no ignorance there. So I appreciate that.
Do it. I think it was very well done.
Yeah.
Thank you. Thank you so much. Thank you both so much. So today really reminded us that the female brain is powerful, it's sensitive, and it's resilient. From subtle brain fog to conditions like epilepsy, migraines, women's brains often carry a lot of issues silently. And people often believe that neurological conditions mean that you cannot live a normal or fulfilling life. But we have proof that you absolutely can. And I think Fatima has been an example of strength, of discipline, and someone who just didn't let her condition define her, and has learned not only to live with epilepsy, but also to excel. And Dr. Mani has showed us how science has taught us one thing: to listen to our brain, to honor its signals, and to care for it every single day. I think your brain is your greatest ally, so you treat it with respect, with compassion, and with love. Until next time, stay informed, stay healthy, and we will see you in the next episode.